Well, as people get older and life expectancy has been increasing, people are thinking about aging in a different way. It's no longer I'm retiring, I'm sitting in my rocking chair and just kind of letting time go by. People are thinking about aging in a very active way. They want to be active, they want to be involved in their community, and they want to be involved in their families in a way that they may not have been able to before because people are living a lot longer. At the same time, people are living longer with more illness, and so now the strategies are really how do we cope with our illnesses and our challenges as we get older and still maintain our independence and quality of life. I think women face several health risks as they get older. One of them is the development of chronic illness. So for example, cancer and heart disease are the most common chronic illnesses that women face as they get older. So that's something definitely to think about. In addition to that, though, women are at high risk for facing social isolation as they get older. They may be retired from their work, their families may be away from the geographic location where they live, their spouses or partners may have passed on, and they may not have their friends around anymore. So it may be something to think about, that social isolation can be something that's very important to think about in advance, because that could be something that women face as they get older. And then thirdly, something that's really important is we think about health problems that occur, but we often don't think about the side effects of the medications we're taking for our health problems. And it could be that as women get older, they develop more and more side effects from the medications they're already taking, and they can develop problems from those medications. So we also want to be sure to think about that. I think there are 5 strategies that women can think about for aging well, staying independent, and living a fulfilled and active life. The first one is to know what works. And what I mean by that is to learn and become empowered about the strategies that do work to help people stay healthy. Things like eating well, exercising, managing stress, and we'll talk about those. The second thing is to make sure they get the care that they need. So many women are busy caring for others and not necessarily voicing what they need for their own health. And so I think getting the care that they need and making sure they ask for what is important in order to take better care of themselves. The third thing is to make sure they avoid the care they don't need. Oftentimes we think that more care is better care, or that more medications, more doctors is better for our health, and that's not always the case. So our role as geriatricians is to help people identify what care they don't need. I think the fourth strategy is to make sure they don't avoid important conversations. So conversations that tend to get avoided are things like, well, what's going to happen when I get more sick? Or what's going to happen when my spouse or partner gets more sick, and who's going to care for them? Who's going to care for me? Another important conversation is who's going to make decisions for me if I'm not able to make decisions for myself. So those kinds of conversations are easy to avoid because they're not topics that we're comfortable with, but when we avoid those conversations, then we don't get the health care that we need. And then the final strategy for aging well is to make sure to become a savvy navigator of the healthcare system. Healthcare system is very fragmented, it's hard to coordinate, to keep track of all the medications that people have to take. So it's really important to learn how to be a savvy navigator of the healthcare system, and that way they can get the care that they need. I think there are a few behaviors that are critically important as women age. The first one is not to stay socially isolated and to stay socially engaged. It's very important to maintain relationships. As I mentioned, as people get older, relationships change, people move away, people die, children are in different places. So it's important for women to stay socially engaged, whether that's through a volunteer organization, through their family, or a cause that's important to them, through their faith-based communities, something that keeps them engaged in life. And I think that's a very important one. The next thing that's very important is to make sure they're getting enough sleep. Sleep is so, we don't get enough sleep in this country, and it's very important to make sure that women in particular are getting enough sleep. We often think that we can get by on 4 or 5 hours, but that's not the case, and lack of sleep leads to chronic illnesses, leads to depression, and can lead to early death. So it's very important for women to make sure they're getting adequate sleep, and that's usually, it's different for everybody, but usually around 7 to 8 hours a night. The third thing that's very important is to make sure they're following an adequate diet that meets their nutritional needs. I generally advocate for a whole foods, plant-based diet for women in order to be able to manage and help prevent complications from their chronic illnesses. And then finally, it's critically important as well to stay active physically. And that can be any kind of exercise that improves strength, balance, or flexibility. It can be yoga, can be running, can be walking. Anything that keeps people moving is going to keep the body healthy and, of course, the brain healthy as well. There are a few tests and vaccinations that I recommend for women as they age. For vaccinations, I recommend making sure they get the flu shot every year, making sure they get the pneumonia shot usually about every 5 to 10 years, depending on their age. Then there's the shingles vaccination, which is optional but could be important for people who are at high risk for obtaining shingles. I also recommend the DPT vaccine, which is the diphtheria, pertussis, and tetanus vaccine. That's another vaccine that's important. And these are all important because we often think of vaccines as being for children, but certainly older adults need to be vaccinated as well as they continue to get older. Then I also recommend certain screening tests as people get older. In particular, it's important to be screened for depression and for falls. These are important things that happen as people get older and that often aren't screened for at a traditional doctor's visit. And it's something that we do commonly in our geriatric assessments. So very important to be screened for any memory concerns, depression, and as I mentioned, falls. I get asked often, at what age do I recommend that people start seeing a geriatrician? And my answer is that there actually isn't an age for seeing a geriatrician. It's based more on the needs of the person. So I have young 50, 55-year-olds who come see me. I also have people who are in their 80s, 90s, and over 100. It's really based more on their needs. So we are like pediatricians in which we take care of an entire population. And when that population needs us is when we see them. So for example, I would say it's time to see a geriatrician if you have a healthcare condition that's starting to really impair your ability to go through life with quality. If you take a lot of medications, if you're in and out of the hospital a lot, if you are starting to feel stressed about your health, or you're starting to feel, your family members are starting to feel stressed about your health care. Those are all good reasons to come see a geriatrician, because what we do is we help coordinate care, we look at the big picture, we help look at mood, medicines, mobility, all of these kinds of things in order to help people have a decent quality of life and be independent and fulfilled. The subject of stress is in the news a lot, and I think stress is a very important contributor to disease in the older population. When we can't manage our stress, our body reacts by developing inflammation inside, and inflammation can lead to a lot of chronic illnesses. So I really express to my older patients that it's very important for them to find coping strategies to manage stress. For many people, it can be through exercise, but in addition to that, it can also be things like yoga, meditation in particular, which is very easy for someone with a disability to do, and really talking about how they're feeling with their loved ones or with someone who they feel is a supportive person. Because managing stress is just as important, if not even more important, than diet and exercise combined. So we don't want to discount the importance of how stress in our lives can contribute to chronic illness. There's actually a correlation between lack of sleep, increased stress, and the development of dementia. It's very important that these be managed carefully throughout our lives because they do work together to create chronic illness. People are so worried as they get older that they're going to develop Alzheimer's or dementia or lose their memory or lose their faculties and become a burden upon other people. And so what I tell people who tell me that is that the best thing they can do is really very simple, is to manage, it's simple but difficult, I guess I should say, but to manage their sleep patterns, make sure they're getting enough sleep, because we said lack of sleep can be an issue, to make sure that they're managing their stress themselves, again through meditation or through other prayer or through other aspects that can give them a way to feel like they're less stressed. And then thirdly, through making sure that they're staying active and healthy, because that can also prevent dementia as well. The three do work together, so we want to make sure people do understand that connection.